thanks again for those that have joined. My name is Matt Reed. I'm the VP of Technical Sales at ITS Partners based in Grand Rapids, Michigan. I also have a big role in driving security strategy with ITS. So what I hope to do was get us started here. So what we're going to talk about today is data security and privacy in healthcare. Our agenda is as follows. I wanted to go through a little bit of the evolution in healthcare and technology. We're going to talk about the reality of healthcare essentially being under attack, what the challenges to that business and that space provide us in the way of data security and privacy, the need for compliance and regulations and frameworks being a very important way out of those challenges in healthcare. Some of the best practices for compliance, security, and privacy in healthcare, and then what Symantec's end-to-end risk management responses that is for those challenges, and how ITS can help you. So first, a little bit about evolution of healthcare and IT. So these are some of the high points in my mind of healthcare's evolution in information and technology. And it starts way back in the 60s when Medicare, Medicaid enactment came into play. We had an IT world of mostly mainframes, central processing, very few vendor products per se for healthcare especially. Everything centered around the admin, financial systems, because billing was all powerful at the time. So it was really all about the billing and very little more. And then in the 80s, once the 80s came along, it was a kind of a wake-up call for the clinical department. And it was also at a time when that was fueled by computers being available for the masses. Medicare and Medicaid also took a big step in that they introduced their first payment system. So we started to see a distribution of data processing compared to the previous 20 years of centralized processing. And then this really important thing occurred where we had a complete integration of financial and clinical information. And that's where things really started to get interesting for healthcare and IT and for patients as well. Year 2000, think back to what I was doing in year 2000. I was a sysadmin camped out in my data center in my company, basically waiting for the paint to peel and waiting for everything to break. It never did. But what also was going on in the way of healthcare IT at the time is when IT and healthcare really came together to kind of create their own taxonomy or their own dimension. So healthcare IT as its own thing was born. The Department of Health and Human Services starts calling for standards around electronic health records and EMR. And the internet also reached an entirely new level where we started to see the clinical systems evolving to a point where not only were we improving, clinician efficacy and increasing patient care, but we had struggles around the implementation of those clinical systems. And at that point, it was probably more so on the point of care side for healthcare, and that's mostly on the EMR side or even electronic prescriptions. It's also when we started seeing Web 2.0. So if you think back, to the original website, so the first generation of websites, they weren't interactive, they weren't bidirectional, they were one direction, and what Web 2.0 brought us was a lot of increased functionality in the way of interactive websites and bidirectional functionality, but it also presented a number of different challenges and inherent risks. 2014, so looking into the current day, internet has become a main source of medical information. So, we've got HIPAA privacy that came around back in 2000, really important security rules there that came along in 2003. But it was interesting because HIPAA, up until that point, had been kind of ignored. It's been kind of been ignored for 10 years after 2000, and then between 2000 and 2000, or sorry, between 2010 and 2014 is when it started to really get what I would consider to be the upper and the lower teeth in the way of high tech, as well as the omnibus rule, and not to mention the different incentives that have come along. Most importantly, meaningful use. So that basically assumes or fosters this idea of certified electronic medical records, kind of the carrot and stick approach. Different stages, different phases to recognize there, but it ends up being like almost $20 billion in incentives out there for companies. So the other thing that comes along, in current day is social media involvement with healthcare. So hospitals and healthcare organizations are making an investment in social media, establishing with the community, providing self-health, if you will, where patients and customers and people are seeking remote guidance and remote assistance, kind of self-directed or self-led, if you will. So kind of taking this all to another level. Compared to the past of like in the 80s and 90s and even around 2000, we've come a long way with mobile technology. Doctors are a lot easier to reach now. They're more effective at their jobs. We've got this idea of telemedicine for even rural or underdeveloped areas, paperless doctor's offices, and here's the thing. I mean, the iPad and the iPhone, it's changing everything, and we have this opportunity for clinician level efficacy or efficiency in patient involvement. That is a game changer because of tablets and smartphones. So, I just had a recent experience with my father, and I took him for a medical procedure, and he entered all of his information and interacted with the clinical staff through an iPad. So, my dad struggles with using a regular keyboard, but he uses an iPad really well. So it was another one of those wake ups and those kind of defining moments that what mobility is doing for patient care. And it even goes beyond that. So doctors have apps for surgery. They can estimate risk, for example, for a given procedure. Maybe it's a heart procedure. So on the fly, ad hoc, they can get extra advice, get extra guidance, along something that's agreed to and defined in the way of helping them estimate risk for a dangerous procedure or a risky procedure. We have mHealth now, a community focused on mobility and healthcare. So we've really come a long way in the last 50 years for healthcare and IT. It turns out that patients don't appreciate having their medical information wind up in the hands of strangers. And when a healthcare organization loses that sensitive information, often en masse, it gets hit with not only customer losses and legal bills, often adding up to a hefty sum, but an average about of $1 million per U.S. hospital per year, or between 6 and 7 billion annually for the entire industry, is accountable there, is associated. So there's debate about how much involves criminal intent when you're talking about breaches or data loss or spillage, but it definitely stands to reason that there's a cause for better security and privacy for healthcare organizations, whether you're concerned about insiders or outsiders. And even just last week, if you look at the headlines, I believe it was an Alberta-based, Canada-based medical group coming under fire because it announced that the health records of 600,000 patients had been compromised in a data breach, reportedly undisclosed for almost 4 months. So they lost an unencrypted clinical laptop. It was stolen from one of the clinic's IT consultants, and it's just basically, again, stands that whether it's insiders or outsiders, we have a cause for better security and privacy for healthcare. Data spills cost U.S. hospitals $6 to $7 billion a year, as I said. And Ponemon Institute is a source that we use, and we found that in reading a lot of that information, they interviewed I think it was like over 60 executives at different American healthcare organizations about their data breach incidents over the last 2 years, and on average, those hospitals and clinics experienced 2.4 data breaches in the last 2 years, and lost about just over 1,700 patient records in each spill. Those same interviewees say that medical patients are less forgiving than other industries' customers when data leaves their healthcare provider's control. The ensuing customer loses a lot. That turns into losses for the provider, and then there's some indirect losses in the way of brand damage, and in total that ends up being represented by like $471 per customer record on average, more than twice the average compromised record of all other industries' breaches. I think it's just roughly over $200 per record. Most common culprits for these hospitals' data breaches were the usual suspects, right? Lost hard drives, USB sticks, laptops, unencrypted devices, along with improperly disposed paper records. So still a lot of that going on, with the final push toward EMR, meaningful use is helping us there. Only about 25% of those incidents involved legitimate criminal intent. So it's not just about the malicious outsider. There's a lot of people that are trying to do their jobs who break policy or cross the line, if you will, in addition to just simple loss of something physical that ends up in the wrong hands. So where to get started? Security and privacy has to become a business strategy, not an IT or operational function. The quickest route, in my mind, to progress and to show due care and eventually due diligence is to leverage market-leading software solutions or tools to automate and transform all of these processes, as opposed to a series of IT projects. Start by recognizing your maturity model for security as an organization. Are your C-level leaders driving the strategic direction? We can see that in the headlines that the consequences, for reckless indifference can be very severe, and can often take you right to penalty and skip any opportunity for settlement or forgiveness. So when we talk to customers about ways to get visibility into risk, we lead with Symantec solutions. But whether you're considering asset value with infrastructure solutions like Altiris, or endpoint level DLP, Symantec's managed security services, these all give us unparalleled collection and correlation of threats to help you visualize and assess your risk. The old school rough and tough way to quantify risk is to consider a potential rate of occurrence, and then factor that against the estimate of an event or a given loss. So in this case, it would be a single loss estimate. And the CISSP program teaches us some very simple arithmetic for arriving at that. But today, we've got terrific tools available like risk breach calculators They can fast factor different cost categories, other considerations to estimate total cost of a breach. ANSI is a really good example of a calculator that can help you do that. So figure out where we are in our maturity. Ask yourselves as an organization some very hard questions in the way of, what is our awareness? What is our ownership? Where do we have our risk? Let's visualize that and then combine the two to figure out where we are, or where we've been, where we are, and ideally where we need to go. So I like to focus on high tech. First there was HIPAA, as I said. Primary goal of HIPAA was to ensure health insurance portability, and that was really around reducing healthcare fraud and abuse. Medical identity theft is obviously a big one there. The other thing that we were trying to solve with that is guaranteeing security and privacy of healthcare information. And then the enforcement of standards for that information. So that's where high tech comes in. High tech omnibus came along after HIPAA and really bolstered it. I kind of consider high tech and omnibus to be like upper and lower teeth for HIPAA. They're clarifications or follow-ups to strengthen HIPAA. So we feel high tech is key, as it essentially addresses the privacy and security concerns that again strengthen the enforcement of HIPAA. So these are some of the fundamental challenges with security in healthcare today. The reality is it's complicated. What is my protected information? What is it? The risk analysis for all PHI, not just ePHI or EHR, but what is everything that is protected? So HIPAA privacy and security rules, the penalties, they now allow for or now apply directly to more so business associates as though they were part of the healthcare organization. So you have to be accountable for those other entities. Covered entities is the nomenclature. Previously, it only applied to them. So including the healthcare organizations, hospitals, physician group practices, insurers, now the rules apply to any organization that has access to PHI or protected health information. So what happens when we have to notify of breaches? Things get a little more complicated. So on the kind of continuing along high tech here, on the security guideline side, we have a terrific start with NIST, and NIST is essentially responsible. They're kind of the backbone or the background of HIPAA and that security rule. And these major provisions are really around encryption. So there's two types of standards to be mindful of in the security rule. There are provisions that are required, and we have some that are considered to be addressable, or I would also say negotiable. The required standard is this, and it's basically that given set of control requirements that are applicable to any entity have to be implemented. So the required standards, got to do it. There's no choice. You have to. The addressable standards, these are control requirements that applicable entities must perform an assessment to determine whether or not it's reasonable and appropriate as a safeguard. So that's the difference here. The safeguards or controls are broken into three areas: administrative, physical, and then technical, which is a majority of what we're talking about here today. On the breach notification side, major provisions are a 60-day notice. Covered entities, as well as their business associates, must notify individuals, within 60 days if PHI is breached. They also need to notify the Department of Health and Human Services and the media if the breach involves more than 500 individuals. So, I talk a lot about security and privacy, but kind of the Trojan horse in this message, if you will, to use security vernacular, is really around compliance. Compliance will drive all of this for you. So we believe in defining your requirements, implement the controls, periodically assess them for efficacy and potential gaps. And along the lines of HIPAA, pay attention to these 4 sections in particular. These are going to give you the most bang for their buck. Starting there shows a great deal of diligence and will get you protecting the right things and thinking in the right areas in order to give you the most headway, or again, the most bang for the buck. Assess the assets, your threats, and your risk. Initiatives we see with healthcare customers there's probably 4 big ones that stand out. Data management, risk and compliance, breach prevention, and mobility. 2 really stand out with us at ITS as far as what is really top of mind with customers today, and that's breach prevention and mobility. So let's talk a little bit about Symantec's responses to both, starting with breach prevention. So we believe at ITS in starting with a methodology of discovery, protection, and management of EPHI at rest, as well as in motion, but also protect against unauthorized access, whether it's an endpoint or other data transmission. Healthcare cannot afford to not have a robust encryption strategy. That's where NIST really is powerful and is compelling and helps us with clarity around what and how. Server security, more categorically recognized than ever before. CSP is a proven and comprehensive solution for protecting where over probably most of your sensitive information, probably 60% or more, actually resides. Standardize and automate. Automate is key. It takes the project and the process when you start thinking about automating IT and organizational compliance across all of your different dimensions of healthcare and IT, infrastructure, process, and people with a product like Control Compliance Suite. Protect against web-borne malware through reputation-based malware filtering technology with the gateway solutions, whether it's mail or web. And then be mindful that there's some terrific encryption and DLP integration on the Symantec side with the gateway solution. Great product. Doing a lot at ITS with the gateway solutions. Then the information infrastructure level. And that kind of requires its own solutions for a breach resilient environment. So when you look at today's advanced persistent threats, they have no chance when you combine gateway solutions from Symantec, Symantec endpoint protection, and critical system protection. They don't have a chance. We've seen this stuff in action. It works. We encourage companies to embrace mobility, and even BYOD for that matter. And there are places to start depending on where you are in your consideration or adoption for mobility. And in healthcare specifically, that's where we see the biggest growth and the biggest push for mobility is healthcare, hands down. So when you're thinking about a mobility initiative, you need to be considering a cloud-based service to issue, renew, and revoke digital certificates, enabling strong authentication, encryption, and signing with a public key infrastructure solution. Evaluate right at the same time, depending on what your needs are, depending on what your use cases might be. You may be better suited for just a simple 2-factor authentication service that supports one-time password or credential options like the VIP solution. Mobile application content management, secure application wrapping and communications. This is where things are going, and that's where App Center is a really strong play. Monitor and protect communications over iOS devices for DLP for mobile. Very important aspect of data loss prevention if you are considering a mobility initiative, DLP for mobile. Some people are trying to get away from, mobile device management. I kind of see it in between worlds, between whether you're talking about mobile device management or mobile application management. It's kind of being boiled all up into mobile enterprise management is what we're beginning to hear and use more. But I still think MDM is kind of relevant given it's kind of between worlds. So we still use MDM. And if you're discussing or evaluating a solution for iOS, Android, Windows related devices, and you need integration with Altiris or with ITMS or even Microsoft System Center, you've got a strong play for MDM if you are focusing at that level. And then the security suite protects Android and Windows specifically from malware threats. So this is Symantec's risk management response that takes what I would consider to really be broad strokes of HIPAA and high tech into consideration. And think of these dimensions of IT. Think about your risk and regulatory presence or requirements, your information governance, clinical applications, the needs of your staff, and you could even be in the ways of training, secure authorization and access. If you ever are asking yourself why Symantec, this is why. And as I build this slide out, begin to see other elements and aspects that kind of revolve around healthcare specific policy and procedures and these different categories and the potential solutions that address them. It becomes a very powerful story and a very compelling argument. So if you ever ask again, why Symantec, this is why. Starting with the policies that you need to adhere to, we can also factor your organizational needs. And then start evaluating at the top your valued assets with Altiris and DLP, including data insight. And then almost at the same time, we have to decide on a measuring stick, if you will, for risk and compliance, ideally with a robust solution like CCS, and then begin to evaluate our ability to mitigate the risk and respond with appropriate resolution and remediation when we do expose risk or identify it. Continuity and recovery, key aspect of security. If you observe the security triad: confidentiality, integrity, and availability. Net backup, Veritas cluster server, those definitely factor in there. I mentioned mobile application management and PKI. Those are giving you the application and user level security. In addition to your typical professional services around these Symantec solutions that we've talked about, we also offer these free product-based assessments that are executed remotely as well as on site. Depending on the situation, we can evaluate these solutions and/or evaluate different elements of your security posture and preparedness through these different initiatives. Whether you're evaluating a solution for a purchase, there are ways to do that with the solutions, or whether or not you could even have an existing implementation of a Symantec security product, and you simply want to get an industry expert to lift the hood and give that a look. So we have all of these different assessments out on our website. You'll find some one-pagers for some of these. Others you can work with your ITS account team, with your regional team, or with Symantec to get us set up and get us engaged with you here. Just a note about health checks overall. ID is nothing new. Health checks have been around for a long, long time. These are just nice, concise package ways for you to get and receive these services and get some help. The deep dive health checks, which you would consider to be more of a paid engagement, those are usually a week or more, and are often fee based. So the security scorecard, I'll just go through a couple of these here. I'll just go through the top row in the interest of time here. This is a non-fee based, as you can see here, red flag type assessment. And that's of an existing Symantec security product. So for SEP, for DLP, or PGP, basically even Guardian Edge, it's basically a half-day console review with a scorecard deliverable, short-term, long-term recommendations, IT staff level report or deliverable, as well as management report. DLP risk assessment, lots of people knows what these are. These are non-fee based as well. 30-day evaluation often of data at rest, data in motion. Malicious activity assessment, or MAA, 7 to 14 days average, passive monitoring of the network, malware that could be going on in your network. It's essentially a free health check for your network. So with that, I think we're going to wrap it up. Thank you very much for your attendance and your participation. Have a good day. Take care.